We need substantially more PPE. Right now, what is available is being prioritized for hotspots like New York, California, and Washington, leaving a state like Oregon with few options. So here's the deal. We have the ability to make more. Right here in Oregon, companies have the experience, the facilities, and the equipment to scale up manufacturing of PPE right now. So the question is, what's the barrier? And from our perspective, for what we're seeing, it's frankly the federal government. They could easily provide clear guidance from the FDA, the CDC, and the National Institute for Occupational Safety and Health to fast-track the approval processes for the manufacturing of respiratory masks and surgical gowns. It's also extremely alarming to hear that doctors and nurses feel like they need to reuse their PPE and risk their own health and safety, or some are resorting to makeshift PPE because it's otherwise not available. I'm incredibly grateful to the companies that have stepped up to help, but voluntary production will not fix this problem at this time. I want to be clear. If these resources were available on the commercial market, I would have bought them. What is unclear to me is why the federal administration refuses to direct industries to manufacture critical PPE. The federal government is not providing the correct specs, and in turn, these companies don't have liability for what they're making, nor can we reliably use them for our healthcare workers. I'm not exaggerating when I say this outrageous lack of action will result in lost lives, including those of our healthcare workers, and it's completely unacceptable. I plan to call the Vice President today, and earlier this morning we sent a letter to him and Secretary Azar. I've spoken with all my fellow governors today. Everyone agrees. We're all in the same boat, and no one knows why.